Where is he? Don't play dumb.
You don't talk to us like that.
You know your type. Always hiding someone.
This is wrong. All of it.
Step aside. Or make this harder.
You picked the wrong hospital. Try it.
The standoff happened at 2:45 p.m. on a Thursday afternoon in the intensive care unit of St. Mary's Regional Hospital. What started as 3 IC agents demanding access to a staff nurse would escalate into an entire floor of medical professionals forming a human barrier to protect their colleague, a stunning capture on hospital security cameras that would go viral within hours, and a federal lawsuit that would ultimately award Jerome Baptiste $14 million while exposing the dangerous intersection of immigration enforcement and healthcare. Real quick, where are you right now? Drop your country or city in the comments. I genuinely want to know who's hearing this story. And if you're new here, do me a favor and subscribe. What I'm about to tell you is one of the most incredible acts of workplace solidarity I've ever researched, and you need to see how this plays out. Jerome Baptiste was 34 years old, an ICU nurse who'd been working at St. Mary's for 7 years. He was Haitian-American, born in Port-au-Prince but brought to the United States as a 2-year-old when his parents fled political violence. He'd grown up in Brooklyn, attended public schools, put himself through nursing school at SUNY, and built a career helping critically ill patients survive their worst moments. He was exceptional at his job. The kind of nurse doctors specifically requested for their most complex cases. The kind who could spot a patient deteriorating before the monitors caught it. The kind who worked doubles when the unit was short-staffed and never complained. His performance reviews were glowing. His colleagues loved working with him. His patients, those who survived, remembered him by name. He'd become a U.S. citizen through naturalization when he was 19. He had the certificate to prove it, filed safely at home with his other important documents. He had a U.S. passport. He voted in every election. He paid taxes. He'd even served on a grand jury the previous year, something only citizens can do. He was as American as anyone born on U.S. soil with documentation to prove it. That Thursday afternoon, Jerome was working the day shift in the ICU, a 12-bed unit on the 4th floor of St. Mary's that treated the hospital's sickest patients. He was assigned to 2 patients, a 67-year-old man recovering from emergency cardiac surgery and a 43-year-old woman with septic shock who'd been in the unit for 9 days. The work was intense, technical, exhausting. Monitoring vital signs every 15 minutes. Adjusting medication drips. Documenting every intervention in meticulous detail. Coordinating with physicians, respiratory therapists, pharmacists. ICU nursing required constant vigilance and split-second decision-making. Lives literally depended on it. Jerome was at his patient's bedside, adjusting in 4-pump and talking softly to the woman even though she was sedated. Research showed that hearing was often the last sense to go, and Jerome believed in treating patients like people, not just bodies connected to machines. That's when his charge nurse, Patricia Reeves, appeared at the door of the patient room with an expression Jerome had never seen on her face, a mixture of alarm and fury. Jerome, don't react visibly, but we have a situation. There are IC agents in the unit asking for you by name. Jerome's hands froze on the 4-line. ICE? Why would IC be here? I don't know, but they're at the nurse's station right now demanding to speak with you. I told them they can't interrupt patient care without going through proper channels. Dr. Kim is backing me up. Jerome felt his heart rate spike. He was a citizen. He had papers. There was no reason for ICE to be looking for him. But he also knew that reason didn't always matter when agents decided someone looked like they didn't belong. What do I do? Patricia's expression hardened with determination. You finish caring for your patient. I'm not letting anyone, federal agents or not, disrupt care in my unit. They want to talk to you, they can wait until you're at a stopping point, and they can do it through proper hospital procedures. She left the room. Jerome tried to focus on his patient, but his hands were shaking now. He double-checked the 4-pump settings, made notes in the electronic chart, and tried to steady his breathing. Through the window of the patient room, he could see the nurse's station. 3 IC agents in tactical vests stood there, clearly agitated. Patricia was between them and the rest of the unit, her arms crossed, her body language radiating authority. Dr. Helena Kim, the attending physician, stood beside her. And now other nurses were gathering, the entire day shift, about 8 nurses total, forming a loose semicircle that physically blocked the agents from advancing into the patient care areas. The security cameras mounted throughout the ICU captured everything in high definition. St. Mary's had installed a comprehensive surveillance system years ago after a theft incident, and now every angle of the nurses' station, every corridor, Every patient room doorway was being recorded continuously. What those cameras captured over the next hour would become the foundation of a lawsuit that would change how federal agencies could operate in healthcare facilities. Jerome finished with his patient and slowly walked out of the room. The moment he appeared, one of the agents pointed at him. "That's him. Jerome Baptiste." Patricia immediately stepped in front of Jerome. "You're not speaking to any of my staff without proper authorization and hospital protocol." The lead agent, his name tag read Morrison, pulled out a folded document. "This is an administrative warrant for Jerome Baptiste. We have authority to question him about his immigration status." "Let me see that." Dr. Kim extended her hand. She was an immigrant herself from South Korea, who'd come to the U.S. for medical school and stayed. She understood both the healthcare system and immigration bureaucracy. Morrison handed over the document. Dr. Kim read it carefully while the entire ICU staff watched. "This isn't a judicial warrant," she said after a moment. "This is an administrative document signed by an ICU supervisor, not a judge. It doesn't give you authority to enter a hospital and remove an employee during their shift. It gives us authority to question him and verify his status. Maybe in a public space. Not in a hospital where he's providing patient care. You want to question him, you schedule an appointment through HR like everyone else. We don't need an appointment. We're executing this warrant." Patricia's voice cut through like a blade. "You're in an intensive care unit. We have 12 critically ill patients whose lives depend on continuous skilled nursing care. You're disrupting that care. You're violating HIPAA by your mere presence near patient areas. And you're creating a hostile work environment for my staff. You need to leave. Now." Have you ever seen co-workers stand up for each other against people with badges and authority? Drop a comment, because what happened next would restore your faith in workplace solidarity. Morrison stepped forward, trying to move around Patricia. Jerome instinctively stepped back. And then something remarkable happened. Every nurse in the unit moved. Not aggressively. Not violently. They simply positioned themselves between the agents and Jerome, forming a human wall across the corridor that led to the patient rooms. 8 nurses in scrubs, standing shoulder to shoulder, blocking access to their colleague. "You're not touching him," Patricia said quietly. "You're not questioning him. You're not taking him anywhere. Not without proper legal authority, not without hospital administration present, and definitely not during patient care hours." Morrison's face flushed. "You're obstructing federal agents. We're protecting our colleague and our patients. There's a difference." One of the other agents reached for his radio. "We need backup at St. Mary's Hospital, 4th floor ICU. We have multiple subjects interfering with an immigration enforcement action." Dr. Kim pulled out her cell phone. "And I'm calling hospital administration, our legal department, and hospital security. Let's see who gets here first." The tension was electric. The agents couldn't push past the nurses without physically assaulting healthcare workers, which would look catastrophic on camera. The nurses weren't backing down. They'd made a collective decision to protect Jerome, and they were committed. Jerome stood behind his wall of colleagues, overwhelmed. These were people he'd worked with for years. People he'd shared holiday shifts with, covered for when they were sick, celebrated promotions and new babies with. And now they were literally putting their bodies between him and federal agents. "Jerome, don't say anything," Dr. Kim called out. "Don't answer questions. Don't provide documents. Not until we have legal representation present." Morrison tried a different approach. "Mr. Baptiste, we just want to verify your status. If you're here legally, this will be quick and simple. Just answer a few questions." "Don't respond," Patricia said immediately. "Ma'am, you're advising him not to cooperate with federal authorities. That's obstruction. I'm advising my employee to exercise his constitutional right to remain silent and to have legal counsel present. That's his Fifth Amendment right. Are you suggesting he should waive his constitutional protections?" Morrison had no good answer to that. The standoff continued. 2 minutes passed. 5, 10. The agents couldn't advance. The nurses didn't move. And Jerome stood there, watching his colleagues defend him with a solidarity that made his throat tight with emotion. Hospital security arrived at the 14-minute mark. 2 uniformed guards who assessed the situation with careful neutrality. "What's the situation?" the senior guard asked. "These agents are trying to remove one of my nurses during patient care," Patricia explained. "They have an administrative warrant, not a judicial warrant. They've refused to go through proper hospital protocols. And they're disrupting a critical care unit." The guard turned to Morrison. "Sir, this is a hospital. We have protocols for law enforcement presence in patient care areas. You need to coordinate with administration. This is immigration enforcement. We don't answer to hospital protocols. Actually, you do. This is private property. The hospital has the right to determine who accesses patient areas and under what circumstances. You want to be here, you follow our rules. Morrison's jaw clenched. He was losing control of the situation and he knew it. We're not leaving without completing our enforcement action. Then you'll be waiting for administration. Hospital administration arrived at the 22-minute mark. The head of HR, the hospital's legal counsel, and the chief medical officer. They convened a quick huddle with Dr. Kim and Patricia while the agents stood at the nurse's station, visibly frustrated. The hospital's attorney was direct and uncompromising. Gentlemen, I've reviewed your administrative warrant. It doesn't give you authority to interrupt hospital operations or remove employees during patient care. If you want to question Mr. Baptiste, you can schedule an appointment through HR. He'll be advised to have legal counsel present. But you're not doing this in the middle of the ICU during his shift. We can detain him for questioning. Not in this hospital, you can't. You want to arrest him, you need a judicial warrant signed by a judge. Administrative warrants don't give you that authority. And if you try to physically remove him from this facility without proper authorization, we'll file charges for kidnapping, assault, and violation of hospital regulations. The agents had run into an institutional wall that wasn't backing down. St. Mary's had resources, legal expertise, and a clear policy about protecting their employees. And they had security cameras recording every moment, every word, every attempt at intimidation. Morrison made one last attempt. We have information that Jerome Baptiste may not be authorized to work in the United States. The HR director stepped forward with a tablet. Jerome Baptiste has been employed here for 7 years. His I-9 verification was completed when he was hired, showing proof of citizenship through his naturalization certificate. His employment eligibility was verified through E-Verify. He's provided a U.S. passport for identification purposes. His social security number is valid and matches his name. We have complete documentation proving he's authorized to work. So I'm curious, what information do you have that contradicts 7 years of verified employment? Silence. Do you have any evidence of fraud? Any reason to believe his documents are false? Anything beyond a hunch or a tip from someone? More silence. Then we're done here. You're leaving. If you have questions for Mr. Baptiste, you submit them through proper channels. But you're not interrogating my employee in his workplace without cause. Should healthcare workers be protected from immigration enforcement while they're caring for patients? Let me know in the comments because this case was about to test exactly that principle. The agents finally left, but not before Morrison turned to Jerome and said, "This isn't over. We'll be back with proper authorization." Patricia immediately responded, "And we'll be ready with our attorney. You touch one of my nurses without cause and you'll answer for it." The moment the agents were in the elevator, the ICU erupted. Nurses hugged Jerome. Dr. Kim squeezed his shoulder. The security guards gave him nods of respect. Patricia pulled him into her office. "Are you okay?" Jerome was shaking. "I don't understand. I'm a citizen. I have all my papers. Why would IC come for me? I don't know, but we're going to find out. And we're going to make sure this never happens again." The hospital's legal counsel arranged for Jerome to meet with an immigration attorney that evening. The attorney, David Wu, was immediately concerned. "Do you have your naturalization certificate?" "At home. In my safe." "Get it? Get your passport. Get every document you have. We need to figure out why you're on their radar." The answer came 2 days later and it was enraging. ICE had received an anonymous tip that Jerome Baptiste was in the country illegally. The tip provided no specifics, no evidence, just a name. A database check had shown that a Jerome Baptiste from Haiti had an outstanding deportation order from 15 years ago. But it wasn't the same Jerome Baptiste. It was a different person with the same name who'd left the country over a decade ago. The database had flagged the name without checking dates of birth, social security numbers, or any other identifying information. The agents had shown up at St. Mary's to detain Jerome based on nothing more than a name match in a database, without verifying they had the right person, without checking employment records that would have immediately shown he was a citizen. It was a catastrophic failure of due diligence that had nearly resulted in a U.S. citizen being detained, possibly deported, definitely traumatized. David Wu was furious. This is exactly the kind of lazy enforcement that violates people's rights. They didn't do basic verification. They just saw the name and decided to grab whoever they found. The security footage from the ICU was damning. It showed the agents arriving without warning, demanding access to Jerome, presenting an administrative warrant that lacked judicial authority, and attempting to remove him from the hospital during patient care. It showed the nurses forming a protective barrier, the hospital administration defending their employee, and the agents ultimately backing down when faced with institutional resistance. The footage went viral within a week. A nurse who'd been there that day posted about it on social media. "Today I watched my entire unit stand between ICE agents and our colleague. They tried to take him without cause. We said no. This is what solidarity looks like." The post was shared hundreds of thousands of times. News outlets picked up the story. "Hospital nurses form human shield to protect colleague from ICE" ran as a headline. The footage aired on national news, showing that moment when 8 nurses stood shoulder to shoulder, refusing to let agents pass. Public reaction was overwhelmingly supportive. Nurses across the country shared their own stories of workplace solidarity. Immigrant rights organizations praised the ICU staff for their courage. And legal experts pointed out that the hospital had done exactly what institutions should do: protect their employees from overreach. Jerome filed a federal lawsuit 6 months later. The complaint was comprehensive and devastating. It named the 3 ICE agents individually, their supervisors, the regional director, and the Department of Homeland Security. It alleged violations of the 4th Amendment, attempted seizure without probable cause, the 5th Amendment, attempted deprivation of liberty without due process, and the 14th Amendment, racial and ethnic profiling. The complaint detailed Jerome's background: naturalized citizen at 19, working in healthcare for over a decade, verified employment through E-Verify, valid passport and social security number, no criminal record, never overstayed any visa because he'd been a lawful permanent resident since age 2. It described the attempted detention: agents showing up at his workplace without verifying his identity, presenting an administrative warrant based on a name match alone, attempting to remove him during patient care, ignoring hospital protocols, and creating a hostile and threatening environment. It included the security footage, the entire hour of confrontation showing the agent's aggression, the nurse's protective stance, and the hospital's institutional resistance. And it included expert testimony about the psychological impact. Jerome had developed severe anxiety about going to work, worried that agents would return. He'd had panic attacks during his shifts. He'd considered leaving nursing entirely despite loving his job, because the trauma of nearly being detained had made the hospital feel unsafe. The lawsuit sought $14 million in damages, $3.5 million in compensatory damages for the attempted detention, emotional distress and career impact, $10.5 million in punitive damages to send a message about the cost of failing to verify identity before enforcement actions. Discovery revealed the full extent of the agents' negligence. Internal ICE communications showed the agents had been given just a name and a location. They'd been told to verify and detain, without being given the tools to verify anything. No date of birth. No physical description. No social security number. Just a name that matched a 15-year-old deportation case. The agents had never checked Jerome's employment records, which would have immediately shown his citizenship status. They'd never verified his identity against the deportation order. They'd simply arrived at the hospital expecting to find an undocumented immigrant and had refused to consider they might be wrong. Depositions of the agents were damaging. "Why didn't you verify Mr. Baptiste's identity before attempting to detain him?" "We had his name and location. That was our verification." "Did you check his date of birth against the deportation order?" "We didn't have access to that information in the field." "Did you check with the hospital to see if he had employment authorization documentation on file?" "That's not our procedure." "What is your procedure for ensuring you have the correct person before attempting detention?" "We verify based on the information provided." "You were provided only a name. Is that sufficient verification?" Silence. "Have you considered that there might be more than one person with the same name?" "Obviously we consider that." "Then why didn't you confirm Mr. Baptiste's identity before attempting to remove him from his workplace?" The agent had no good answer. Expert witnesses testified about 4th Amendment requirements. Law enforcement cannot seize someone based solely on a name match without additional verification. They need probable cause that the specific individual is the subject of their investigation. Showing up at someone's workplace with an administrative warrant based on insufficient identification is unconstitutional. Medical professionals testified about the impact on healthcare when ICE conducts enforcement in hospitals. Patients avoid seeking care. Healthcare workers operate under threat. The trust necessary for effective treatment is destroyed. And in Jerome's case, excellent care was nearly disrupted because agents hadn't done basic homework. The nurses who'd formed the protective barrier testified as well. Every one of them stated they'd do it again without hesitation. Jerome is my colleague, Patricia testified. He's saved lives in our unit. He's one of the best nurses I've worked with in 25 years. When those agents tried to take him without cause, without even verifying they had the right person, I wasn't going to let that happen. We protect our own. The testimony from the 8 nurses was powerful. They described their split-second decision to form a human barrier, their collective understanding that what was happening was wrong, their willingness to put their jobs and potentially their safety on the line to protect a colleague they knew was innocent. Have you ever refused to cooperate with law enforcement before? Jerome's attorney asked one nurse. Never. I respect law enforcement. But those agents weren't doing law enforcement. They were doing lazy targeting based on insufficient information. That's not justice. That's just rounding people up based on hunches. The trial lasted 4 weeks. The jury watched the security footage repeatedly, that moment when the nurses moved in unison to block the agents, the standoff at the nurses' station, the hospital administration defending their employee, the agent's ultimate retreat. They heard Jerome testify about the experience, about the terror of seeing ICE agents at his workplace asking for him by name, about the confusion of being told he was subject to deportation when he'd been a citizen for 15 years, about the trauma of nearly being taken from his patients mid-shift, about the panic attacks that followed, the therapy required, the months of looking over his shoulder waiting for agents to return. I've dedicated my career to saving lives, Jerome said from the witness stand, his voice steady but his eyes reflecting the pain of the memory. I work in critical care. My patients are dying. That's not dramatic. That's the reality of ICU nursing. And on that Thursday, I had 2 patients whose lives depended on me, and federal agents tried to remove me based on nothing more than a name they hadn't even properly verified. If my colleagues hadn't protected me, I would have been detained. Maybe deported. And my patients? They'd have been left without their nurse because someone couldn't be bothered to check a date of birth. The jury also heard from Jerome's patients. The woman with septic shock had survived and made a full recovery. She testified about waking up days after the incident and being told what had happened, about learning that the nurse who'd kept her alive had nearly been taken away. Jerome saved my life, she said simply. And they tried to take him because of paperwork they didn't even verify. That's not acceptable. The defense tried to argue that the agents had acted in good faith based on the information available to them. But the evidence of negligence was overwhelming. They'd been given insufficient information and had proceeded anyway. They'd ignored readily available verification methods. They'd attempted to detain someone at their workplace without confirming identity. The jury deliberated for 2 days. When they returned, their verdict was clear. Liable for attempted unlawful seizure. Liable for negligent enforcement. Liable for violation of due process rights. Liable for intentional infliction of emotional distress. Compensatory damages, $3.8 million. Punitive damages, $10.2 million. Total, $14 million. The verdict was one of the largest ever awarded in an immigration enforcement case involving a U.S. citizen. The message was unmistakable. You cannot attempt to detain people based on inadequate information. Names alone are not sufficient identification. And the cost of laziness in enforcement is measured in millions. The 3 agents were terminated. Their supervisor was demoted. ICE implemented new protocols requiring verification of at least 3 pieces of identifying information before any detention attempt. Name, date of birth, and either social security number or physical description. Supervisors were required to review all information before authorizing field detentions. And hospitals were designated as sensitive locations requiring additional authorization before enforcement actions. St. Mary's Hospital became a case study in institutional protection of employees. HR conferences used their response as a model for how to handle federal enforcement attempts. Legal seminars examined how the hospital's attorney had defended against overreach. And nursing organizations held up the ICU staff as examples of professional solidarity. Jerome used part of the settlement to create a legal defense fund for healthcare workers facing similar situations. He partnered with immigrant rights organizations to provide training on how to respond if ICE appears at your workplace. And he continued working at St. Mary's in the same ICU, with the same colleagues who'd stood between him and detention. 2 years after the incident, Jerome was invited to speak at a national nursing conference. He stood before 5,000 nurses and told his story, the agents at the nurses' station, the protective wall his colleagues formed, the hospital administration's refusal to back down, the legal battle that followed. I'm standing here today because 8 nurses decided that protecting me was more important than avoiding conflict with federal agents, he concluded. They didn't know how it would turn out. They didn't know if they'd face consequences. They just knew it was wrong and they stood up. That's what solidarity looks like. That's what having each other's backs means. And that's what we all need to do, in our workplaces, in our communities, everywhere, when we see injustice happening. We stand together. We protect each other. We say no to overreach, no to lazy enforcement, no to treating people as disposable. That day in the ICU, my colleagues showed me what it means to be valued. And I'll spend the rest of my career trying to pay that forward. The nurses' station in St. Mary's ICU looks the same as it did that Thursday afternoon. The security cameras are still there, still recording. But now there's a small plaque on the wall behind the desk, placed there by hospital administration. On this unit we protect our own. We stand together. We defend each other. Always. It doesn't mention the incident specifically, but everyone who works there knows exactly what it means. What would you do if federal agents showed up at your workplace to take a colleague without proper verification? Would you stand up? Would you form that human wall? Drop your thoughts in the comments. And if this story reminded you that solidarity is powerful, that standing together matters, hit that subscribe button. These stories aren't just about lawsuits and settlements. They're about people choosing courage when it would be easier to look away. See you in the next one.